This is your National Registry Medical Assessment Oral Board Station. Do you have any questions before we begin?
No.
Okay. You are called to a residence for a lethargic patient. As you walk in the door, you discover a 52-year-old man stumbling around the living room naked. He becomes slightly combative when you attempt to make him sit down. With the help of his wife, you are able to convince him to have a seat on the couch. The wife tells you that she returned home from a morning out shopping with her friends to find her husband in his current condition. He left the house when she did for his weekly 20-mile bike ride.
Okay. BSI scene safe.
Your seat is safe?
Do I have all my resources and equipment?
Yes, you do.
Number of patients?
You have one patient.
MOI, NOI?
Just this guy walking around his house naked, kind of confused.
Okay. And my general impression?
General impression is kind of as you see him, you're able to get him sat down, but he is definitely confused.
Okay. Is there any reason to take C-spine at this time?
No, not at this time.
Okay. His level of consciousness?
Responsive, but definitely confused to your questioning.
Okay. Chief complaint?
Can't really get that from the patient, but the wife tells you that he has sugar problems.
Okay. I'm going to go ahead and assess the patient. Is his airway patent?
It's patent and open, yes.
Okay. What's his breathing rate and quality?
Okay, he's breathing at 12 times a minute with symmetrical chest rise and fall.
Okay. I'm going to go ahead and put him on 15 liters non-rebreather.
Okay, he accepts the non-rebreather.
Okay. Do I have a pulse and approximate rate and quality?
Radial pulses are present, equal, and it feels slightly tachycardic.
Okay. And what's his skin like?
A skin condition is pale, cool, and diaphoretic.
Okay. Any killer bleeds?
No killer bleeds.
All right. I'm going to go ahead and consider this a load and go.
Why is that?
Just the way he's presenting to me and the way he's lethargic and unresponsive.
Okay.
Yeah. Assuming he's naked at this time, so I don't need to cut and expose.
Okay.
Any medical alert tags?
No medical alert tags.
All right. Let me get a baseline vitals.
Okay.
What's his level of consciousness? Just unresponsive still?
He's responsive to you,
Responsive.
but confused.
Okay. Confused. His pulse?
His pulse is 112 per minute.
Okay. His blood pressure?
Blood pressure of 118/90.
Okay. Respirations?
Respirations are still at 12 a minute.
Non-labored?
Non-labored, yes.
Okay. Pulse ox?
Pulse ox was 97% on room air.
Okay, after I've got him on the non-rebreather.
Now they're at 99%.
Okay, 99%. Let me get a D-stick.
Okay, 27.
Okay. His pupils.
Pupils are pearl.
Okay. Let me hook him up to the monitor, 12 lead.
Okay. You note sinus tachycardia with no ectopy.
Okay. Let me go ahead and administer an IV, left AC, 18 gauge.
Okay. Established.
Okay. Let's get a bag going. We'll set the rate at 30 drips a minute.
Okay. What would you like that bag to be?
Oh, normal saline.
Normal saline. Okay.
Okay. Let me go ahead and get a sample history from the wife.
Okay.
Got the signs and symptoms. Does your husband have any allergies?
He is allergic to shellfish.
Okay. And is he taking any medications?
Insulin.
Insulin. Does he have a history of anything like this you've seen before? Any medical history?
He does have diabetes.
Okay. And what's his last thing he ate?
He had breakfast about 3 hours ago.
Breakfast 3 hours ago. Okay. And you said you were gone, but was he acting normal before you left?
He was, yeah.
Okay. Okay, I'm going to go ahead and get my 6 rights before I administer my drug of choice. Go ahead and get my right patient, right drug, right dose, right route, right documentation, and right time.
Okay.
Okay, I'm going to go ahead and administer D50, 25 grams through my IV.
Okay.
With a 20 cc flush.
Okay.
Okay, let me get a second set of vitals.
Okay. Your blood pressure is now 124/82. Pulse is now 90 beats per minute. Respirations are still at 12 breaths per minute.
Okay.
Pupils are still pearl. Pulse ox reads 99%.
Okay.
And blood glucose is 120.
120. Okay, and what's my level of consciousness?
It improves to alert on APU.
Okay.
Your patient is now becoming embarrassed about his lack of clothing and apologizes for, quote, bothering you.
Okay. Well, it's no problem, sir. We're here to help.
I'm sure you are.
Okay, let's go ahead and get en route. We'll call a radio report and monitor my patient. We're going to monitor every 15 minutes since he is stable.
Okay.
And let's go ahead. Let's get a third set of vitals.
Okay. Blood pressure is now 126 over 84. Pulse of 86. Respiration still at 12. Pupils are pearl. SpO2 at 99%. Blood glucose at 120.
Good. I'm going to go ahead and just reassess all my interventions and just get to the hospital.
Okay. Is there anything else you'd like to do for this patient?
At this time, no.
Okay. This concludes your station.